Hello everyone. Now let's talk about that how the hypothyroidism will present. Now hypothyroidism is the decreased production of the T3 and T4 hormone. So that normally what happens is the thyroid gland is stimulated by TSH and it mainly produces T4, some amount of T3, but you just remember T4, and that T4 is then converted into the peripheral tissues by the T3, which is the active thyroid hormone. Now the T3, what T3 does is that T3 is required for the normal body development and functioning. In the previous video in the hyperthyroidism, we have talked about that how T3 is essential for increasing the basal metabolic rate, increasing the functioning of various cells. So it is not only required for functioning, but if the patient hasn't developed yet, such as infants, if the development hasn't occurred, so what will happen that their functions of their cells will also lead to their development as well. So now here we have two scenarios in this case. So since it is required for the normal body development and functioning, so if the development of the body hasn't occurred yet, say for example in the infants or in the younger children, so what will happen that decrease in hypothyroidism in these cases, decrease of the thyroid hormones in these cases, it will manifest as developmental issues. So the patient will have mental retardation and all that stuff like that, the developmental issues. So these patients will mainly present in the childhood with these conditions, the developmental issues, and this condition is called as cretinism. Whenever there is hypothyroidism in the infants, so that manifests as cretinism. Now the second thing is that if second scenario is that if the development has occurred and the hypothyroidism occurs after the development of the baby, that is that the patient was congenitally he was normal, he was euthyroid, so normally its development has taken place normally, but now later after the development has completed, now in the adulthood he present as hypothyroidism due to some reason. So what will happen in these older patient, their body will have decreased function. We have talked about that how the thyroid hormone increases sodium potassium ATPase in the previous video, and that is required for the whole body function. So the whole almost all the cells of the body require thyroid hormones for their increased functioning and the normal functioning. So in these cases there will be decreased body functioning, and this decreased body function, this manifestation in the adults is called as myxedema. So you have two scenarios. If the development hasn't occurred yet and the hypothyroidism occur, it leads to the cretinism, and if the development has occurred, it leads to myxedema. Now let's talk the manifestations of the hypothyroidism. Now the hypothyroidism in infants, we talked about that in infants there will be decreased development, and these patients will mainly present with decreased development of these babies. So what will happen that since it is required for normal development, so these patients decreased quantity of this will lead to the mental retardation. These patients will have short stature, they will have skeletal abnormalities. Moreover, they will have coarse facial features and enlarged tongue, and umbilical hernia is common in these patients. So you just imagine a patient with decreased development of their bones, their skeletal bone, their structure, as well as their mental retardation will happen in this patient. So there will be decreased growth, there will be decreased development of their mental as well as physical growth. So that will lead to the mental retardation, short stature, skeletal abnormalities, coarse facial features, and enlarged tongue. And umbilical hernia is common in this patient. Why enlarged tongue? You will see it shortly. Now, if you look at the myxedema or the manifestation of hypothyroidism in adults, so you just remember the previous hypothyroidism video where we have talked about all the symptoms from top to bottom. So in the same way we will cover the symptoms of the hypothyroidism. So basically that there will be decreased functioning of the body, so you will just take a system and decrease their function. So that is what the manifestation of hypothyroidism will be. First of all, we started from CNS, so here it will be slowing of the mental activity. Remember, in hyperthyroidism there was hyper functioning of the mental activity, there were anxiety and that kinds of stuff, but here you will have slowing down of the mental activity. Here, since your body isn't producing enough heat, so you will be intolerant to cold and you will have decreased sweating. in the hyperthyroidism there was increased sweating due to the adrenergic stimulation of T3. But here there is no adrenergic, there is no sympathetic stimulation. So as a result, what will happen? There will be decreased sweating. Moreover, a typical symptom that is associated with it is enlarged tongue and deepness of voice. Now, the enlarged tongue, we have also talked about it in here, that it also occurs in children. So, why does enlarged tongue and deepness of voice occurs in hypothyroidism? That you know that due to the myxedema, it is due to the myxedema, and why? That the myxedema is actually not edema. It rhyme as edema, but it's not actually edema, but it is the accumulation of the glycosaminoglycan that occurs in the hypothyroidism. You will also see this in hyperthyroidism, Graves disease, where there are some IgGs that will be circulating, and though they stimulates the fibroblast to produce glycosaminoglycans. But remember that enlarged tongue and deepness of voice due to the accumulation of glycosaminoglycan occurs in the hypothyroidism, and the main target site in hypothyroidism are tongue and larynx. So the tongue and larynx here in hypothyroidism these occur, whereas if you look at in the Graves disease, the the main symptoms, the accumulation of the glycosaminoglycans, they occur retroorbitally, that leads to the exophthalmos, and the pretibial edema, pretibial mixed edema, that is at the shin. So at the shin and retroorbital accumulation of glycosaminoglycan occur in hyperthyroidism, Graves disease, whereas in the hypothyroidism this accumulation occurs in the tongue as well as in the larynx. So in the larynx leads to the deep voice, whereas the tongue leads to the enlarged tongue. So we have started from the slowing of the mental activity, cold intolerance at the forehead and decreased sweating, and then we said that there will be enlarged tongue and deepness of voice. Now in the neck vein there will be no hyperglycemia, as we saw in the hyperthyroidism. There will be no hyperglycemia here because T3 is mainly diabetogenic hormone. It causes hyperglycemia, but since it is low, so there will be no hyperglycemia. Moreover, there will be bradycardia and decreased cardiac output. Why is it? Because the heart is now not stimulated by the T3 mediated sympathetic response. So there will be bradycardia and decreased cardiac output that will lead to the decreased cardiac output will manifest as shortness of breath and fatigue. Okay, now the next one is muscle weakness and weight gain despite of normal or decreased appetite. So these patients will have muscle weakness, but they will gain weight. Why they are getting weight? They are gaining weight. They are gaining weight because their BMR is low. They are producing, they are using less and less of their energy. So what happens that weight gain occurs in these patients? There will be hypercholesterolemia because they are not using that much of cholesterol. There will be constipation in this patient because of decreased motility of the gut. There will be oligomenorrhea, menorrhagia, infertility, and impotency that occurs in this patient. The mainly the whole system, the gynecological system is it causes decreased function, so that leads to all these symptoms. Some other symptoms that are associated with the hypothyroidism, these are skin changes, that is these patient will have dry skin, they will have dry hairs and alopecia. Moreover, some neurological depression may occur, such as the carpal tunnel syndrome and delayed relaxation of the reflexes. So just remember these as separate, especially associated with the hypothyroidism. Now let's remember them all with the help of from top to down. We are going to study it. First of all, slowing of the mental activity. Then at the forehead there will be decreased sweating and cold intolerance. Then this patient will have enlarged tongue and deepness of voice. They will have no hyperglycemia. They will have bradycardia and decreased cardiac output. Then they will have muscle weakness in the limbs and muscle weakness. Then you reaches the tummy and there will be weight gain, hypercholesterolemia. Then and the tummy also there will be constipation, and if you reaches the pelvis there will be oligomenorrhea, menorrhagia, infertility, etc. And then finally you study some special features that are related to it, that is, as the skin there will be dry skin, dry hair, alopecia, etc., and neurological depression as well. So these are all the manifestation of the hypothyroidism. Thank you very much, and do subscribe my channel for further upcoming videos.